So picture two different households, right? Both of them have this massive, just beautiful Cane Corso.
Yeah, gorgeous dogs.
Oh, absolutely. And, both are these really loving, attentive homes. The owners absolutely adore their dogs. They're feeding them these top-tier diets, giving them tons of affection. But their approaches to healthcare could not be more different.
Which is, I mean, that's where the story always diverges, right?
Exactly. So the first owner, they schedule a wellness visit every single year, just like clockwork. I mean, they show up at the clinic even when the dog looks like the picture of perfect health.
Yeah, totally fine.
Right. But the second owner takes a completely different route. They only make the trip to the vet when something is visibly, undeniably broken. Like a sudden limp or violent vomiting or maybe a mysterious lump that just seemed to appear overnight.
Right, which sets up a very common, very stark divide in how we approach the stewardship of an animal's life.
And here is the kicker from our source material today. That first owner, they almost never deal with a massive, late-night, super high-stress emergency. Like, they sleep soundly.
Because they're ahead of the curve.
Yes. But the second owner, the one waiting for the alarm bells to ring, basically, they always seem to find themselves sitting in some stark, fluorescent-lit vet exam room at 2 in the morning, facing this incredibly expensive crisis every year or two.
Which is exhausting and scary, quite frankly.
So scary. So welcome to today's deep dive. We are looking at this fascinating stack of veterinary insights focused entirely on adult preventative care for the Cane Corso. And our mission today is to extract the crucial mechanical difference between proactive systems and reactive scrambling.
Yeah, decoding why daily habits are absolutely non-negotiable for these large, heavy-duty guardian breeds.
Exactly, because whether you are managing the health of a giant canine or, looking after your own well-being, or maybe you're just fascinated by how small proactive systems prevent massive systemic failures, the insights we're covering today apply directly to you.
They really do. Because preventive care, by its very nature, it suffers from a terrible PR problem.
A PR problem? How
Right.
so?
Well, it simply isn't glamorous. Like, when a preventive system works perfectly, nothing's on fire.
Right.
There are no sirens, there is no dramatic rescue, and, because there is no immediate crisis demanding your attention, it is incredibly easy to deprioritize.
It's the whole, if it ain't broke, don't fix it mentality.
Exactly. But that first owner in your opening example, they aren't just lucky. They're actively hunting down microscopic invisible issues while they are still microscopic.
Okay, let's unpack this, because I really want to look at the sheer physical reality of the Cane Corso. I mean, if you were listening to this right now, maybe you have one of these dogs asleep at your feet, or maybe you're just fascinated by how biological systems scale up. We are not talking about a Chihuahua here.
No, definitely not.
This is a giant, heavily muscled working dog that can easily tip the scales at over 120 pounds.
Easily. And that mass changes everything.
It does. If we think about this mechanically, the everyday wear and tear on their joints, the literal physical workload required for their heart just to pump blood around that massive frame, it is exponentially greater than in a smaller breed.
It's just simple physics at that point.
Right. I like to think of a Cane Corso like a heavy-duty commercial pickup truck hauling concrete every single day.
That is a great way to look at it.
Yeah.
The vulnerabilities of a machine under that much constant load are immense. I mean, you wouldn't drive a commercial truck hauling heavy loads and just skip routine maintenance.
Of course not.
You wouldn't say, well, the engine block isn't actively smoking yet, so let's just keep driving. Waiting for the smoke is a terrible strategy for a machine under daily stress.
Yeah, you'd blow the engine.
Exactly. And the sources point out specific physiological predispositions that come with the Cane Corso's heavy-duty frame. We are talking about severe joint degradation, specific cardiac conditions, and the terrifying risk of bloat.
Oh, bloat is terrifying.
Yeah, it really is. It's a condition where that massive, deep-chested stomach actually fills with gas and twists on itself, which literally cuts off its own blood supply.
Which is an immediate, fatal mechanical failure if it isn't caught in time.
A total systemic collapse. And when a dog is carrying that much mass, if a joint starts to degrade, the friction and inflammation multiply incredibly fast under all that weight.
Because it's, what, over 100 pounds just grinding down on a small area?
Exactly. And if a heart valve isn't perfectly efficient, the strain is magnified by the sheer volume of tissue that heart has to constantly oxygenate. Catching these subtle underlying biological shifts early, it makes treatment far easier, exponentially safer, and considerably less costly.
Compared to, like, trying to fix it when it's totally broken.
Right. Trying to reverse engineer a solution once the joint cartilage is completely gone or the heart muscle's already failing is just a nightmare.
So, if we're operating this heavy-duty concrete hauling truck, and we know we need to take it into the specialized mechanic regularly, we really need to understand exactly what that mechanic is looking for.
We do.
The standard recommendation in the sources for a healthy adult cane corso is an annual wellness visit. But the moment they hit their senior years, that requirement bumps up to twice a year.
Yeah, because biological time simply moves differently for giant breeds.
It goes faster, right?
Much faster.
Yeah.
The cellular aging process accelerates. So a year between visits for a senior Corso is essentially giving a silent disease process several human years to advance completely unchecked in the dark.
Wow. Several human years.
Yeah, so moving to 6-month intervals creates much safer, more manageable checkpoints to catch that accelerated aging.
Okay, but let me push back on this for a second. Let's say my dog is running around the yard. He's eating perfectly, looking incredibly shiny and vibrant. I live with this animal. I watch him eat, sleep, and move every single day.
Right, you're the one there.
Yeah, I know his baseline better than anyone. So isn't paying for a wellness exam when nothing is visibly wrong just a pricey formality? Like, what can a vet actually see during a physical exam that an attentive, loving owner can't see?
Well, what's fascinating here is the concept of the trained eye, paired with specialized tactile examination.
Yeah.
You absolutely know your dog's personality and daily habits better than anyone on Earth. But a thorough veterinary physical exam covers physiological mechanical ground that casual home observation simply cannot replicate.
Like using actual medical tools.
Exactly. They are listening to the heart and lungs with a stethoscope, picking up on these minute, subtle fluid sounds or micro murmurs that don't yet cause a cough or a slowdown in energy.
So they are looking under the hood in a way I just can't do from the couch.
Spot on. And they are actively palpating the abdomen. The vet is using their hands to literally feel the margins, the size and the shape of the liver, the spleen, and the kidneys.
Oh, wow, they can feel the actual shape of the organs?
Yes, they are feeling for slight enlargements or abnormalities that you would never, ever see from the outside of a thick, muscled dog. And they're also checking the actual mechanical range of motion in the joints.
Which I guess is hard to see when they're just walking around.
Right. An owner might watch their dog walk and think, oh, he's just slowing down a bit because he's getting older. But the vet physically manipulates the leg and realizes, no, there is a specific measurable restriction in the left, stifle.
The stifle.
Yeah, that's the anatomical term for the dog's knee joint.
Ah, okay. So they are cross-referencing my specific dog against a massive mental database. Like, my baseline is a sample size of 1. Their baseline is an entire population of thousands of giant breed dogs.
Exactly. They know exactly what normal feels like, which
Wow.
allows them to spot a deviation long before the dog decides to openly show pain.
And from what I understand, guardian breeds like the Cane Corso are remarkably, sometimes frustratingly stoic.
Oh, incredibly stoic.
Yeah.
Hiding pain is a deeply ingrained evolutionary survival mechanism for them,
Because in the wild, showing vulnerability makes you a target.
right? Precisely. By the time a Corso is openly limping, whining, or crying out, the underlying issue has usually progressed to a highly advanced, severely painful stage. The vet's trained eye basically bypasses that stoicism.
Okay, so if the vet is using their hands and stethoscope to assess the physical mechanics, they are also managing the invisible threats. Like, a heavy-duty truck needs physical repairs, but it also needs clean fuel and oil to protect the engine from the inside out.
That's a great transition into the internal side of things.
Yeah, let's look at the internal preventative shields the sources outline, starting with vaccinations, because it's not just a blind checklist, right?
Right. The sources outline this highly localized, two-tiered approach to adult vaccines. So you have your core vaccines, which every dog needs on a regular schedule to prevent universally fatal diseases like rabies or distemper.
The non-negotiables.
Exactly. But then you have a second category, which are the lifestyle vaccines.
Which depend entirely on the specific, localized risk factors of your individual dog. Like, if you were listening to this and you live in a concrete high-rise in a desert city, your dog's threat matrix is totally different from a dog living on a wooded farm in the Northeast.
Completely different. You have to consider whether your dog goes to crowded dog parks, if they stay at a boarding facility while you travel, or if they are, hiking through tick-heavy brush.
It requires an ongoing, highly specific dialogue with your vet rather than just some one-size-fits-all timeline you downloaded from a random internet forum.
Yeah, exactly. And that same localized logic completely reshapes how we need to look at parasite prevention, too.
Right. The sources are incredibly firm on this. Heartworm, fleas, ticks, and intestinal parasites. It must be a year-round conversation. It's no longer just a summer concern.
We used to operate under the assumption that a hard winter freeze would simply kill off tick populations and mosquitoes.
Giving dogs a natural break from prevention in the colder months.
Right, but modern microclimates, especially around our heated homes and concrete foundations, they keep these parasites alive and active year-round now.
Wow.
So taking a break from prevention in January, it basically leaves a massive gap in the dog's immune shield.
And the stakes of leaving that gap open are catastrophic, particularly with heartworm. I mean, we aren't just talking about a mild cough here.
No, not at all.
These are parasites transmitted by a single mosquito bite that physically grow into long, spaghetti-like worms that physically clog the pulmonary artery and the chambers of the heart.
It's as gruesome as it sounds.
The mechanical damage to a giant breed's heart is devastating. Preventing it takes a simple monthly chew, but repairing it takes brutal, risky chemical treatments.
And even then, the heart might never fully recover.
Exactly. But there's another internal system the sources highlight that completely caught me off guard. It's an internal shield we almost never associate with vital organ health.
Talking about dental care.
Yes, dental care.
It remains arguably the most widely overlooked, misunderstood aspect of canine preventive medicine today.
So what does this all mean? Like, when I read the sections on dog dental care, honestly, it sounds exactly like my human dentist lecturing me about flossing.
Oh, for sure.
We all know we're supposed to do it. We all know it's technically good for us. But if you are listening right now, let's be real. Almost nobody actually brushes their dog's teeth perfectly every day.
It's true. It's a very common struggle.
So if I only manage to brush my giant dog's teeth a few times a week, does that actually accomplish anything biologically? Or is this an all-or-nothing task where if I can't be perfect, I just shouldn't bother stressing out the dog?
It is absolutely not an all-or-nothing scenario. Brushing just a few times a week with a dog-specific toothpaste makes a profound, medically significant difference compared to never brushing at all.
Okay, that's a relief.
Yeah, because the reason we care isn't about curing bad dog breath. It's about preventing systemic chronic inflammation.
So we aren't just trying to keep the teeth white.
Not at all. Plaque naturally builds up on the teeth. And if it isn't physically disrupted by the mechanical action of brushing, it hardens. That hard material continuously irritates the gums, leading to severe gingivitis.
Ouch.
Yeah. Now here is the critical physiological cascade. Those inflamed, bleeding gums become a direct, open highway for massive amounts of bacteria in the mouth to enter the bloodstream.
Oh, wow. It's like a leaky pipe in the foundation of a house that slowly rots the drywall on the second floor. The bacteria doesn't just stay in the mouth.
Exactly. It circulates through the entire vascular system. And that bacteria forces the dog's immune system to remain in a constant, exhausting state of high alert. It drains metabolic energy.
He's constantly fighting this low-level infection.
Right. And more importantly, that circulating bacteria has been directly linked to microscopic, cumulative damage in the heart valves, the liver, and the kidneys.
That is wild.
So if you're brushing their teeth, you are actively protecting their major internal organs from a chronic, daily bacterial assault.
Okay, so if the immune system is draining all its vital resources, fighting off mouth bacteria, it doesn't have the metabolic capital to repair the immense wear and tear happening to the dog's skeleton.
Exactly. Everything is connected.
Which means we have to look at how we protect the external frame holding those organs up. The dog's structural foundation requires its own dedicated maintenance, completely reframing how we view the basic grooming routine.
Right. Shifting our perspective of grooming from a cosmetic, aesthetic chore to a vital, tactile, structural health check is a major takeaway for a giant breed owner.
And the Cane Corso's short coat is a massive advantage here, isn't it? It's inherently low maintenance.
Oh, it's great.
The sources suggest a quick weekly brushing, and you really only bathe them when they are visibly filthy or smell, because overbathing strips the natural oils and destroys their skin barrier.
Right. You don't want to dry them out.
But the real hidden benefit of that short coat is that your hands are right on the dog's surface. You can easily part the fur and inspect the skin for new lumps, bumps, or strange redness that a thick-coated dog would hide for months.
You are essentially performing a superficial physical exam every single time you run a brush over them.
And this hands-on inspection extends directly to the ears, too.
Yes. Regardless of whether a Corso has cropped ears standing up or natural floppy ears laying flat, the biological care routine is identical. You're checking for excess wax buildup, angry redness, a yeasty odor, or dark discharge.
Because catching that early minor irritation before it erupts into a deep, full-blown bacterial ear infection that saves the dog weeks of intense, disorienting pain.
Absolutely. Ear infections are miserable for dogs.
Here's where it gets really interesting, though. Of all the grooming tasks mentioned in the source material, the one that completely blew my mind in terms of its sheer mechanical impact on the dog's long-term health was nail trimming.
It is so frequently dismissed as just a minor, annoying detail to outsource to a groomer every few months.
Right, but think about the biomechanics of the foot strike. If you are looking at your own dog right now and you hear their nails clicking on the floor, listen to this.
This is crucial.
If those nails get too long, they hit the hard ground before the paw pad does. So when the heavy dog stands, the long nails physically push the toes upward and backward.
Right. It pushes the toes out of alignment.
It literally alters the angle of their foot. Imagine you are forced to wear shoes that don't fit right, or like you have to walk around all day in a shoe with a completely uneven, broken heel.
Your body compensates. Over time, that misalignment doesn't just make your foot ache.
It travels straight up the kinetic chain, it wrecks your ankles, then it starts grinding away at your knees, and eventually it completely destabilizes your lower back.
It changes everything about how you move.
Now,
The-
take that exact same kinetic chain reaction and multiply it by a 120-pound dog carrying maximum load. That altered weight distribution adds a staggering, destructive amount of unnecessary stress to joints that are already working overtime.
Exactly. If we connect this to the bigger picture, maintaining a natural, comfortable gait through something as simple as a weekly nail trim actively preserves the joint cartilage over the dog's entire lifespan.
Just by clipping the nail.
Just by clipping the nails.
Hmm.
The golden rule in the sources is that the nails should be kept short enough that they never click loudly on hard floors.
It is a tiny 5-minute mechanical intervention that prevents massive, debilitating orthopedic degradation down the line. And when you add in a quick check of the massive paw pads for painful cracks or embedded debris, you are literally protecting the foundation of the dog's entire physical structure.
You're keeping the chassis perfectly aligned.
But let's take a step back and notice who is actually doing all of this daily monitoring.
Yeah.
Who is hearing the nails click on the kitchen tile? Who is feeling the small pea-sized lump under the short coat during a brushing session? Who is smelling the subtle change in the ear?
The owner, the person living in the house.
Which brings us to the final and perhaps most vital piece of the proactive puzzle. The owner is the ultimate diagnostic tool. The vet is the expert mechanic, but the owner is the early warning radar system.
That's a perfect way to phrase it, because the vet only ever sees a snapshot. It is a brilliant, highly educated snapshot, but it is still just a 20-minute window into one specific day.
Whereas the owner is watching the continuous unbroken film of the dog's life.
Exactly.
And the sources emphasize that the only way to successfully utilize that continuous film is by establishing a solid, objective baseline. You can't just look at your giant dog every day and guess if they are healthy.
No, memory is too flawed.
You have to track data. Take weight trends, for instance. You weigh them regularly because a slow, creeping 10-pound gain over 6 months or a sudden, unexpected drop in weight, those are massive red flags.
Right. 10 pounds on an adult human might just mean your genes are a little tight. But 10 pounds of excess fat on a giant breed dog is a massive, highly inflammatory burden on a heart and joints that are already operating near their structural limits.
That extra weight is just brutal on them.
It really is.
Huh.
And conversely, a sudden drop in weight despite a normal appetite could signal a hidden metabolic issue, a thyroid problem, or a developing internal disease that requires immediate investigation.
But it goes beyond just hard numbers like weight, right? It's about noticing subtle behavioral shifts. The sources give incredibly specific, illuminating examples. We are talking about a dog that normally leaps into the back of an SUV, but today they hesitate for just a second before making the jump.
Yep.
Or a dog that usually devours their dinner in 3 minutes, but suddenly takes 10 minutes and chews a little slower. Or even just a subtle drop in enthusiasm for their absolute favorite walking route.
And none of those isolated incidents on their own scream, rush to the emergency room.
Right, but if I take my dog to the vet and say he hesitated before jumping into the car today, the vet might examine him for 5 minutes and not see a single thing wrong. The adrenaline of the clinic might mask the pain.
That happens all the time.
But because I know my dog's continuous film, I know that hesitation is a clear, undeniable deviation from his normal, everyday baseline.
Which is exactly why keeping comprehensive, lifelong medical records is so crucial. Tracking vaccines, past blood test results, previous treatments, and those subtle weight logs creates vital continuity of care.
So you aren't just starting over every time.
Right. If you move across the country, if you travel frequently, or if your dog develops a complex issue that requires an oncology or orthopedic specialist, the new veterinary team isn't starting their investigation from zero.
The sources mention utilizing digital tools like the Vital Pet app to track all this scattered information. You can log the vaccine dates, the current medications, the specific diet and protein ratios, and the subtle behavioral changes you notice on your morning walk.
It keeps it all in one place.
It does, but I have to ask, is there a danger here of going too far? Like, is meticulously tracking every single sneeze, every slight hesitation, every mealtime in an app actually overkill?
I hear what you're saying.
Are we at risk of overpathologizing normal animal behavior and becoming overly paranoid helicopter parents who are just creating massive anxiety for ourselves?
This raises an important question about the fine line between helpful observation and paralyzing obsession, because nobody wants to be stressed out 24/7.
Right, that doesn't help the dog either.
Exactly. The crucial distinction lies in the intent behind the tracking. The goal of using these tools is not paranoia. It is simply establishing a reliable, objective baseline.
Just getting the facts down.
Yes. An app, or even just a dedicated notebook on your kitchen counter, is a companion tool. It is absolutely not a substitute for a professional veterinary evaluation. You aren't trying to diagnose the dog yourself.
Please don't try to diagnose your giant dog yourself.
Right. You are simply organizing the raw data so that when you do walk into the clinic, you are handing the vet a rich, detailed, accurate history, rather than relying on your foggy memory of what happened over the last 6 months.
You bring your organized list of behavioral changes, your current medication dosages, the exact diet info. You are effectively handing the specialized mechanic the exact puzzle pieces they need to use their trained eye to maximum effect.
Noticing and documenting your own dog's normal daily patterns is quite literally the single most valuable, powerful preventive tool you possess.
So as we wrap up this deep dive into the Cane Corso, the through line is incredibly clear. Preventative care is not just a passive formality or a way for clinics to pad their schedules with wellness exams.
No, not at all.
It is a highly proactive, highly aggressive strategy against systemic failure. It's about brushing teeth to protect a heart valve from bacterial assault. It's about clipping nails short to save a knee joint from mechanical degradation.
It's all connected.
It's about establishing a baseline to catch the tiny, quiet anomalies early, ensuring that a massive, hardworking guardian breed gets to live fully, comfortably, and happily for as many years as biologically possible.
It represents the ultimate act of stewardship for an animal that relies entirely on your observation.
Beautifully said. Now, a quick, important reminder from our source material today. This discussion is meant for educational purposes only. If you are ever concerned about your dog's physical health or behavioral changes, you should always consult your veterinarian directly. Podcasts and apps do not replace that critical professional medical relationship.
Absolutely true. But before we sign off, consider this. We've just spent this entire deep dive exploring how absolutely crucial it is to establish a rigorous baseline for a giant dog.
We really did.
We meticulously track their weight. We notice a microsecond of hesitation before they jump. We monitor minor shifts in their appetite, all to catch massive underlying biological health issues before they explode into a crisis.
You put massive effort into observing them.
So what subtle creeping changes in our own daily habits are we completely ignoring? What slow shifts in our own energy levels, our own physical posture, or our own sleep and diet patterns are we just brushing off simply because we don't have a giant objective observer walking behind us, diligently tracking our baseline for us?
Wow. Now that is something to think about the next time you feel a little ache in your own knee. Until next time, keep observing, keep asking questions, and we'll see you on the next deep dive.